You can be firm but gentle. Make sure that area is washed really well. We're going to take our soap and pour it right under his head. We don't need a lot because his head surface is very small. Just firm but gentle. Make sure you get around the neckline. Now we're in the rinse cycle. And you know when the soap is out by feel. Okay, so we've rinsed his head thoroughly. We're taking him back to the counter. And this little head. Very gently lower his head. We're going to dry everything we just washed. So we wash, rinse, and dry. Rinse our washcloth, and we're starting with the face. We don't need soap on the face. We'll start cleaning the eyes, and we want to go inside corner out, and the reason for that is if there's any dirt or little dust particles or sleep in his eye, you're taking it away from the eye and you're not bringing it into the eye. If you need to do it twice, you can take another finger, just clean part of the washcloth. We're going to wash the rest of his face. Start with the forehead, down around the cheeks, by the front of his ear. Okay, we'll do under his nose and his mouth area really well where he gets a lot of milk collection, down around his chin. There. Okay, then whatever we wash, we dry. You just take the bottom of the towel, very gently dry him off. Okay. Now we're going to wash the top part of his body, and we'll go from the neck down, and we will use soap. Okay. And you want to get under the neck really well in that fold of the abdomen. And we go around the umbilical cord, and you give your baby your sponge bath until the umbilical cord falls off. And if it's a little boy and you've chose to have a circumcision, you have to wait until that heals. And you want to pay attention to the folds under his arms really well. Hi. Okay. Wash his little hands. Now we're going to rinse everything we just washed. So under the neck once again really well. And very gently lay down his head. We're going around the umbilical cord. Okay. Just wait until he releases his arm very gently. So now we're going to do the lower half. Rinse this off. Put more soap on our washcloth. The diaper area is a very important part, Nicole, because you want to make sure he doesn't get diaper rash from the stool and urine bacteria that can accumulate on his skin. And then we'll just lift up his legs very gently. You can hold them with one hand and get way up his back where you couldn't get when his diaper was on. Now we're going to rinse. Everything we just washed, we're rinsing. Okay, take your hand way up his back. Then what I recommend is getting his diaper on as quickly as possible. Let's take your diaper and slide it up the back. There we go. Okay. Stand there. Hi, Chase. Okay. And the last thing we're going to do is brush your hair. There you go. Neat and tidy. Okay, so you have your infant hairbrush, and what I would recommend is really firm but gentle. And the reason you want to brush his hair, beside neatness, is to stimulate and circulate the oils in the scalp. There you go. You can sit him up. Turn him over to get the back hairs. And there's your nice clean boy.
That was great, Michelle. Thank you.
You're very welcome. I hope you learned
Thank
a
you.
lot. You were great, Chase.
What should I use to cut my baby's fingernails?
You'll need a baby scissor or a fingernail file.
And when should I cut his nails?
Well, the best time is when he's asleep, but since he's awake, let's do it now.
Okay.
There's your scissors. Okay, we're going to take the tip of the finger, gently pull back, place the scissor under the white part of the nail, and 2 to 3 snips should take care of that. Great. If you find he's getting too fussy or crying or moving around a lot, I would recommend not cutting his nails and waiting till he's asleep.
What is cradle cap?
Cradle cap is a normal flaking of the skin that combines with excessive oil to the scalp and builds up into thick, oily scales.
What do you do for it?
I would call my pediatrician. Some hospitals no longer recommend cord care with alcohol. They found it dries out the cord. I still do cord care with alcohol to keep the area clean. It's just my training. If you choose to do cord care, you will need cotton swabs and rubbing alcohol. Gently clean all around the cord and in all the creases. If the cotton swab is dirty, use another until you feel the belly button area is clean. When the umbilical cord is about to fall off, the cotton swab may be bloody. That's okay. Remember to attach the diaper below the cord. Many people take care of circumcision differently. Whoever performed the circumcision follow their aftercare directions. Your baby's tip of the penis may be red for a couple of days after circumcision, then turn yellow. This is normal. Signs of infection from circumcision. Your baby's circumcision may be infected if his penis swells. Restricted or decreased urine, persistent redness, a crusted sore that does not heal. If you observe any of these symptoms, notify the person who performed the circumcision. I prefer disposable diapers, but if you've chosen cloth diapers, that's okay too. Nicole, if your baby's fussy, it may be because he has a wet or dirty diaper. So to change his diaper, unsnap his clothing, take his legs out, gently lift his legs and bottom, slide your clothing up above his waist, open his diaper gently, make sure to fold back the tabs so they don't stick to his skin. And for a little boy, I would recommend having a little cloth to cover him. After all, you don't want to get sprayed. Okay, open his diaper. You can use cotton and water, but you can also use diaper wipes. Take your cloth. Take your used cloth, put it in your diaper. Then, Nicole, I would use some petroleum jelly that will act as a protective barrier on the skin. You can apply it with your finger. Bring up your fresh diaper, tab side at the back. Take your diaper and push it up his back. Take the diaper, lift it up, open your tab, Fold it onto the diaper. Give a nice secure push for it to fasten closed. And gently put him back in his clothing.
Why do babies get diaper rashes?
The main reason for diaper rash is irritation of your baby's skin caused by urine and stool.
What can I do to prevent diaper rash?
Keep your baby's skin clean and dry, and use petroleum jelly as a protective barrier. Signs of severe rashes: raw and reddened skin, bleeding or cracked skin, blisters, white or red bumps. If a rash does not get better in 2 to 3 days, call your baby's doctor. A breastfed baby generally has a bowel movement after every feeding, but it is not uncommon for him or her to have a bowel movement 1 to 2 times a day. A bottle-fed baby will have a bowel movement 1 to 2 times a day. Signs of constipation: hard or dark pebbles of stools, blood-streaked stools, stools that are difficult to expel, 4 to 6 days without a bowel movement. If you observe any of these signs and suspect constipation, call your baby's doctor. Just to let you know, constipation occurs more with bottle-fed babies. The main reason for constipation is lack of water in the baby's stool. What is in a diaper? Black, tarry, and sticky is meconium and the first stools from a newborn baby. Dark green transitional stools are past the first couple of days after birth. Bright yellow loose stools are from a breastfed baby. Green, brown, or greenish-brown stools are from a bottle-fed baby.
What is diarrhea?
Diarrhea is the frequent passing of loose, watery stool. If you open your baby's diaper and you see just a water ring and no formed particle of stool, this may be diarrhea. Your baby can get dehydrated very quickly, and this can be a sign of a more serious condition, so call your pediatrician immediately. Signs of dehydration. Your baby is probably dehydrated when you notice any of the following symptoms: can't keep fluids down, diarrhea for 4 to 6 hours, no tears when your baby cries, sunken eyes, dry or chapped lips, soft spot is sunken in head, stringy spit at the corner of the mouth, decreased urination. If you notice any of these symptoms, call your baby's doctor immediately. Other clues of a sick baby. Here are some additional signs to look for if you think your baby is sick: lethargy, a general lack of coherence, a fever of 101 degrees or more, excessive inconsolable crying or lack of crying, unresponsive to touch or sound. For any of these symptoms, call your doctor immediately. How to understand a crying baby. Babies cry because they need something. It's your job as a mother or father to figure out what your baby needs. Your first response should be to feed your baby. Other possible reasons for a crying baby might be a wet or dirty diaper, needs to burp, needs to suck, needs to sleep, needs to be held and comforted, needs to be stimulated, is overstimulated, is too hot, too cold, or is ill. Assuming your baby has been fed, burped, and changed, a few other ways to comfort your baby may be to rock your baby, sing to your baby, walk with him, put your baby in a bouncer, or maybe try to swaddle your baby. Newborns like to be swaddled because it represents how they felt in the womb. Remember, right now, crying is their only way of communication. Your baby is trying to tell you something, and it's your job to figure out what your baby needs. Determining if your baby has gas or colic. If your baby has the following symptoms, it could signify gas: excessive crying after a feeding, a rumbling stomach, drawing up of legs, a hard abdomen, or after gas is passed, they are relieved. To relieve gas, burp, press legs to your baby's abdomen, or ask your pediatrician for over-the-counter remedies such as Milocon drops for gas or chamomile tea. Colic is a pattern of newborn behavior in which your baby has excessive, inconsolable crying at any time in a 24-hour period, a high-pitched scream, drawing up of legs and clenching fists, a hard abdomen, and they are not relieved after they pass gas. There are no remedies for colic. After about 3 months, gas and colic should disappear. Call your doctor if you suspect colic. When you place your newborn into your car seat, make sure you have a headrest. This will ensure neck stabilization. Once your baby is securely positioned, buckle all straps and latches. Make sure you read the directions on your car seat, as every car seat is different. You know, Nicole, 92% of all parents install their car seats incorrectly. So I recommend having it professionally installed. And there may be a 2-month waiting list in your area, so don't procrastinate.
Where do I get his car seat installed?
You can check with your local baby store or visit a website. Websites for car seat safety and installation.
How did it go?
Great. Thank you, Michelle. I feel much more confident about being a mom.
You're welcome, Nicole. You're such a quick learner.
We hope this video makes you a more confident mom. But we want to stress that if you're ever in doubt about anything, just call your pediatrician. No question is a stupid question when it comes to your baby. And remember, as parents, your instincts are a very valuable tool, but only if you use them. So, take care, congratulations, and good luck.